Hello, my name is Craig Prince, and the reason you're watching this video is because you've gotten a link that allows you to be able to quote out your own Medicare coverage. The first thing I would like to bring to your attention is a disclaimer that is required by law that we read to you. I'd want you to know that we do not offer every plan available in your area. Any information that we provide is limited to those plans we offer in your area. So please contact www.medicare.gov or 1-800-MEDICARE 24 hours a day, 7 days a week to get information on all of your options. But having said that, we are contracted with the best carriers we feel in each of the areas that we offer service. And so I'd like to show you a few features about how to utilize this. First of all, my name is Craig Prince. And as you can see, my name is up here. Also, I work with an organization called Caress Insurance Agency, LLC. And they are a great help and a great mentor for helping us to be able to get you the very best plans. First of all, if I was coming to this screen, and I'm going to use personal information, I would put my zip code. So in my case, my zip code is 91710. It will bring up my county, and that's important to make sure that that county is correct. And so now if I go into view the plans, it will bring up all the plans that are available in my area. Again, I'm going to share with you some items from the top of the screen. First of all, you'll notice that in this county we represent 34 different plans that are available for you to consider. Now, this Medicare Advantage prescription drug simply means that it's what we commonly refer to as an MAPD, or a Medicare Advantage prescription drug, which has the medical and the prescription as part of this. We also offer plans that are what we call Medicare Advantage. Those are ones without prescription drugs. When would that be applicable? Well, if you were a veteran and you simply wanted to look at plans but didn't need the prescription because you have it through the VA, this would be a good option to look at. There are those of you who might want to consider Medicare supplements as your option. And so you would come over here and look at the Medicare supplement plans that are offered. And also, if you were going to go with Medicare being through a Medicare supplement, you would need to consider a standalone prescription drug plan. So hopefully this helps you to understand what this is. I'm simply going to go down here to show you how to get the best out of what you see here. So you'll see that there are various filters. So if you want plans that are, as an example, some of these plans may have a premium. So if you want plans that are under $49, then you certainly could press that filter. If you wanted add-on coverage for dental or vision, you could press those. If you knew a specific carrier that you wanted to work with, and you'll see all the carriers that are listed here, then you certainly could just narrow it down to looking at that one carrier. And there are also what we call plan subtypes. So there are Medicare Advantage HMOs, there are Medicare Advantage HMOs point of service plans, there are plans that are what we call local PPO Medicare Advantage plans, and then there are PPO Medicare Advantage plans. A good place to start would be on this getting started. So if you wanted to look at preferences to estimate your cost, first of all, you might come here in adding preferences, and you'll see that we get started. We're just verifying in this area what we want to do. So in our case, again, we're looking at medical and prescription drug plans. And sometimes people get help through various entities. For example, you might be somebody who gets full help through Social Security, what we call a low-income subsidy, extra help. You may get partial help, be on a plan considering partial help. Might be a plan where you're getting Medi-Cal on a share of cost. So if you don't get any help, and I'll just use my example, I don't get any help, then I would go into and hit continue. You'll notice that the next screen it comes up to is health. And so it wants to know how old I am. So I fall in this and then in this. And then if I want to estimate my medical costs, then I can basically answer questions. You know, how much I utilize the coverage. In my case, I don't want to because I'm a fairly healthy person. And so I'm going to hit continue. So this screen, I may want to find out if particular doctors are on my plan. So there's a good doctor. Let's say I want to use Dr. Amiri as my primary care physician. I can hit search, and then her name comes up. And so I'm going to add her as my provider that needs to be in the plan. This just assumes that I want Dr. Amiri. And of course, I can set her as my primary care provider. Okay. And by the way, you could put several doctors here without having them as your primary care. But if you wanted to list one as a primary care, that's great. And then the next thing that you would come down to is prescriptions. And so let's just say that you're on blood pressure medication. And notice that I just start typing the name of the drug, Benazepril, and it comes up here. So I take Benazepril, and I actually take the lowest dosage. So if I'm going to add this, I can add this prescription, and it shows that this prescription is going to be considered. Or if I have a my Medicare.gov account where I've gone into Medicare.gov, created a personal account, and have put my prescriptions there, I can connect into the my Medicare.gov account and download the prescriptions that I'm taking. Either way, that works. If you put your prescriptions into Medicare.gov and have saved that through your My Medicare account, then you don't need to re-put all the drugs or look them all up. You can just download them. All right. And then let's say, and again, in consideration of pharmacies, some of you may use online pharmacies. For years, I've gotten mine, even though I currently get them online, I've gotten them at Walmart. And so I'm going to search Walmart to pharmacy, and it comes up that that pharmacy that I have been using is right here. So I can add that. And then I could have several pharmacies on here. I mean, I could actually go and put CVS. Oops, sorry. Search them and say, okay, here's a CVS. We'll add that pharmacy. So now I'm going to have a pharmacy that I'm claiming is my primary pharmacy, but I can also add another pharmacy. Or I can say, you know what, maybe I want to set CVS as my primary pharmacy. So I can do that. And then I hit continue. Now notice that the plan is thinking about it. So what it's going to do is, based on my choices, it's going to tell me about that particular doctors. And so on the providers, it's not finding the provider. Okay. It says that one prescription, the one prescription I put on there is on the formulary, and that Walmart Pharmacy is a contracted and preferred pharmacy there. Okay. And because I didn't estimate my annual cost, it's, if you will, the annual cost of that drug, because the drug I'm taking is a $0 copay with that carrier, then I'm not going to have any costs. Okay. And you'll see that it does that on all the plans. All right. So again, if I wanted to see, let's just say I said, oh, geez, I want a United Healthcare. And let's see how that works out with the doctors that I've got. And so if I go up here, it says that under this focus plan, that my doctor's in the network, my prescriptions are on the network, and that the pharmacy is a preferred pharmacy. So in looking at all the plans that are available, that may be important. Now, once you've gone through this, folks, and have chosen your various things that you want to filter by, if you need my help or assistance at that point in time, then you certainly could come up here to the top, and you'll notice that if you push that down, there is a number here. This number right here, I need you to save that so that if we want to talk and we don't want to have to re-put all the information in, this number will enable me to go in on my side of the website and be able to look up the quote that you are specifically looking at. If at the end of the day I said, I want to go on this particular plan, the Medicare Advantage Focus HMO Point of Service plan, I'm going to add that to the cart. And then once it's added to the cart, then I can go on to continue to apply. So one of the things that's interesting, at least right now, is because that plan is a 2023 plan, I cannot enroll in that plan until the annual enrollment period, which starts October 15th and goes to December the 7th. Please also be aware that if you're on a Medicare Advantage plan and you choose a plan during the annual enrollment period, and if you're not happy with it, you can always make a change during the open enrollment period, which is from January 1st to March 31st. I hope this video has been good, that you found value in it, and that it'll help you in getting quotes and enrolling if that's what you want to do.